Thank you for being with us. Apologies for the delay in getting to you this morning. The government's published its battle plan for dealing with coronavirus. What are you going to do?
Well, we've got a clear strategy for dealing with coronavirus, a very, very significant challenge, as we were discussing there with John McDonnell. And the plan is very clear. Firstly, to contain this virus. That's the stage we're in now. We hope that we can succeed in doing that. It means that every single case that is found here gets immediate, not only treatment, but also we contact all of the people that person's been in close contact with. We make sure they get the full medical advice, and we try to stop the spread here in the UK. Of course, there's cases coming in. Largely, most of the cases so far are from people who've caught the virus elsewhere and brought it here, and we're then able to contain it. But of course, whilst we're doing that, we're also planning in case this gets worse, much worse, and that has three strands to it. The first is to delay the onset, because it's far better if we do get this in a big way. It's far better if that happens in the summer. And it's also better if the peak is not as high, so to speak, if the timing of it is spread out. The third strand is to research. We've put £40 million into trying to find a vaccine and also trying to improve the treatments for people who do have the disease. And we can talk about that, but the experts say that a vaccine, even as accelerated as fast as possible, is still many months off. But the potential for treatments that make the virus less of a problem if you've got it, they are more optimistic. And then the final part of the plan is to prepare for mitigation should this become endemic in this country, as it has in other parts of the world, and making sure that not only the NHS is prepared, of course, but also all parts of society. And this is something where government has got a huge role to play, but so does every single person, actually.
I want to talk a bit more. I want to talk a bit more about that as well, because many of our viewers will be thinking, what steps should I be taking to protect myself, to protect my family? The Director General of the World Health Organization, for example, tweeting that over 60s should avoid crowded areas, places where they could interact with people who are sick. I mean, is that good advice? Should people over 60 be avoiding public transport, not going to routine appointments with their GP?
Well, not now, because the number of cases is still relatively low, and as I say, we're trying to contain each and every one. If we get to the position where this is endemic right around the world, and large scale here, then we will change the advice according to what the scientists advise for what is the best sort of behaviour. So at the moment, the best thing people can do is make sure that they wash their hands for 20 seconds or more. We're telling children that you've got to wash your hands whilst you sing Happy Birthday to make sure that gets through very simply. Making sure that you use soap and hot water. That is the single best thing that everybody can do. And also catch a cough or a sneeze if that happens. And then thirdly, follow the public health advice if you think you've got it. Now, if we get to a position where this is much more widespread, then of course we will change the advice to deal with that. But at this stage, people should go about their ordinary business. You know, I want to minimise the risk to the public, but we also want to minimise the social and economic disruption that will be inevitably caused, and we've already seen it this week, caused by a virus like this.
At the same time, though, some will be thinking the government sounds like it's just waiting until things get worse. Aren't there things that people should be doing now to prevent that situation happening? In France, for example, they've banned indoor gatherings of more than 5,000 people. Is this the kind of thing that the UK government should be considering?
Well, we're considering all options. We have a full range of planning. I've been undertaking COBRAs for several weeks now and leading that planning with the Prime Minister, and making sure that we've got all those plans in place. But there's a danger to doing things too early because they wouldn't be effective. At the moment, the number of cases in this country is 23, and that means that so long as people are washing their hands and taking the precautions that are set out, that is the right thing to do. We don't rule out taking any of these other measures, and there are more cases in France, Germany, Italy than there are here in the UK, but we will advise on those measures when it is right to take them. Because, as I say, we want to minimise the economic and social disruption, subject to keeping people safe.
Is this a balancing act, then, between keeping people safe and minimising the economic disruption?
Look, it's a balancing act where I place the greatest weight on keeping people safe. But there's no point in doing things that aren't clinically effective. We have to be guided by the science here. I think that's a really important principle. So when people come to me with suggestions of things that we should do in order to minimise it, I will check those with the epidemiologists, with the scientists, who are some of the best scientists in the world. And if they're effective, then we'll consider doing them. But if they're not going to be effective, then that's why we choose not to. For instance, in the last couple of weeks, I've had some people say to me, why don't we just stop all flights from China? And I asked the chief medical officer, and he explained that if you do that, then people find other ways to come into this country. We're a very open country. And indeed, the only European country that did do that and stop all the flights was Italy. And they've ended up as having more cases than any other European country because it wasn't an effective thing to do. And so that's the approach that we're taking. We are looking at every single option, and we're planning with a clear battle plan for how we rise to the challenge of this virus. At the moment, we're in the contain phase, and that means that we still hope that we may be able to contain this without it becoming widespread. But as soon as we think that that isn't possible anymore, then of course we'll move on to the next stages of the plan, which are very much in place.
Should you cancel your holiday to Italy? You mentioned there that it's the worst affected in Europe.
You should follow travel advice, and the travel advice has changed to the affected parts of northern Italy to advise against all but essential travel there. And if you go through an airport, you should be very careful and make sure that you wash your hands. Airports are safe, but they're places where you should absolutely be following the advice on washing your hands more often.
Many people are worried, of course, about what would happen if this does become a pandemic and how the NHS would cope. We've just heard from John McDonnell, who is claiming that 10 years of austerity has had its impact on the health service and whether or not that means that they would be less able to cope with a pandemic. What's the government line on this? How many beds are available?
Yeah. Well, he's wrong. The NHS is treating more people than ever before. But of course, this would be a very big pressure on the NHS, depending on the scale of the impact. At the moment, we've already expanded the number of the high acute critical care beds that we need, and we've got the option to be able to expand that further should we need it. We've expanded it to 50 in the first instance when there's relatively few cases, but that can go up. We've got plans to take that up to 500 and then 5,000 if that's necessary. So we've got those plans in place. The other thing that is in place, which of course is receiving a huge amount of calls, is NHS 111. And I just want to say a great big thank you to everybody who's working on NHS 111. It only came in 2 or 3 years ago. It's been incredibly helpful because it means that people can call instead of going to their GP, and that's obviously safer for everybody.
OK. Now, the Prime Minister will be chairing a meeting of the Emergency Committee COBRA tomorrow. We know, of course, that you've been chairing meetings with officials over the last week. Now, of course, everybody needs some time off. Not everybody needs to be on TV every time they're working. But some will be wondering if there's a bit of a pattern forming. The Prime Minister very slow to visit flood-hit areas recently. He hasn't been working or he hasn't been in Number 10 this weekend. Why is it not that the Prime Minister has been chairing emergency committee meetings already at a time when many people are concerned about coronavirus and many people will be looking to the Prime Minister for leadership?
The Prime Minister's been all over this. I have daily calls with him, often more than once a day, and I've been updating Cabinet weekly. I've been chairing, as you say, those COBRA meetings, cross-government, not just officials but ministers, a case of ministers and officials working incredibly well together. And the Prime Minister is fully on top of all of this, and that's the way it should be. But he's part of the team. He leads the team. You say that you question his work ethic. I'll tell you what. Last week he did a night shift at a hospital to find out what it's really like on the front line at 2 o'clock in the morning. I applaud him for doing that. I think I've learned a lot from doing night shifts in the NHS, and I'm really glad that he's done one too. So. The PM's all over this. Clearly, I'm leading the operational response and working incredibly closely with him and every other member of the government.
Now, keen to ask, while we have you, about another big story this weekend. Sir Philip Rutman, the top civil servant in the Home Office, resigned, says he's going to be suing the government for constructive dismissal after claiming the Home Secretary mounted a vicious and orchestrated campaign against him. Does the government welcome people who speak truth to power, or are they just a nuisance?
We work incredibly closely with officials who say exactly what the facts are as they see them and advise, and that's the way it should be. Priti is a very determined person, but she's also very courteous. And I think that if you're looking at coronavirus again, the way that officials and ministers have worked together has been absolutely impeccable, as well as, of course, the medical experts and the scientists, and a great example of everybody pulling together in the case of a big challenge. And so, I don't know the details of this case, and clearly there's going to be a court case, so I'm not going to go into the details. But what I'd say is that, Priti, we all know that Priti is determined, and that's right, that's good in a Secretary of State, that's what you want to see. And she's also very courteous in her dealings, and I very much hope that we can get on and deliver the government's agenda, the 20,000 police that she's recruiting, and making sure that we crack down on crime. That's actually what people really care about.
OK. Matthew Hancock, thank you very much for being on the programme this morning. Thank you.